So let's talk about how to start antidepressants for depression and anxiety. So we'll be talking about the starting doses for different antidepressants and how to titrate the dose if you feel that the medication is not effective or not working as well as it should be. So let's start with citalopram. So citalopram for anxiety can be taken as a 10 milligram dose. Bear in mind that for anxiety, citalopram can take anything between 4 to 12 weeks before you start seeing the maximum effect of the medication. However, during this period, you can gradually increase the medication every 3 to 4 weeks by 10 milligrams. So if you start on 10 milligrams of citalopram for anxiety or panic attacks, after 3 to 4 weeks, if you feel the medication is not working sufficiently, you can then increase it to another 10 milligrams, which would be 20, and over 3 to 4 weeks, then increase to 30 milligrams, and the maximum dose is 40 milligrams. For depression, the starting dose for citalopram is a 20 milligram dose, and with citalopram, it can take 4 to 6 weeks to see any effects. Again, similar to the 10 milligram dose, every 3 to 4 weeks you can increase by 20 milligrams to 40. So for citalopram for anxiety, it's 10, 20, 30, 40. For depression, it's 20, 40. Now, a lot of people have mixed depressive and anxiety disorder, which means they have both depression and anxiety occurring together. So you can usually start with a 20 milligram dose, and after 3 to 4 weeks, then you can increase it to 40 milligrams. Now, if we look at sertraline for anxiety, ideally you would want to start at a 25 milligram dose, and it can be increased after a week to 50 milligrams. Then you've got 75 milligrams, where you can take a 50 milligram and a 25 milligram tablet, and then you can increase to 100 milligrams. Then you've got 150, then you've got 200. However, sertraline is not readily available as a 25 milligram tablet. So if you have a 50 milligram tablet, you can break half the tablets to make it 25 milligrams. Or conversely, you can decide to start at 50 milligrams. For depression, sertraline is usually given at a 50 milligram dose and is increased by 50 milligrams. So usually after 1 to 2 weeks, I would increase sertraline to 50, 100, 150 to a maximum of 200 milligrams for sertraline. Do bear in mind that with sertraline, it is one of the medications that can cause bleeding if taken with ibuprofen. So if you're taking an anti-inflammatory painkiller such as ibuprofen, you should let your doctor know, or you will need to take a tummy protection tablet such as omeprazole. With mirtazapine, the starting dose for depression would be the same as anxiety. So usually you would start with a 15 milligram dose, which is usually taken at night time, and then you can increase it to 15 to 30 to 45 milligram. Most people on mirtazapine usually would see an effect within 1 to 2 weeks. So I'd usually increase mirtazapine every 2 weeks. So if I start you on 15 milligrams, if you're not really seeing much of an effect, I can increase it to 30 and then increase to 45. Bear in mind, mirtazapine is also good for sleep, so it's usually taken at night time and not taken during the day, because if you're taking during the day, you'll be falling asleep at work. Now, fluoxetine doesn't really work so much for anxiety. It works better if you've got both depression and anxiety, as opposed to having anxiety on its own. So fluoxetine is a very effective antidepressant, but I would usually give it mainly if you've got depression and not anxiety. With fluoxetine, which is also known as Prozac, I would usually start you at a 20 milligram dose, and then every 3 to 4 weeks, similar to citalopram, I'd increase it to 40 milligrams to a maximum of 60 milligrams. The most common side effects which people complain about with fluoxetine tends to be tiredness and excessive yawning. Now, venlafaxine is another antidepressant that I'm not really that much of a fan of due to the side effects. If you're taking it for anxiety, you would want to start at a 50 milligram dose once a day, and is increased every 2 weeks to a maximum of 225 milligrams. For depression, it's usually given as a 75 milligram dose once or twice daily, and is increased every 2 weeks to a maximum of 375 milligrams. We would usually advise to do a baseline ECG before you start the medication, because venlafaxine has an increased risk of causing abnormal heart arrhythmias. So if you notice any irregular heart rate or heartbeat, you need to let your doctor know. Also, venlafaxine is not given if you've got uncontrolled high blood pressure, because it can increase your blood pressure. So usually if you're on venlafaxine, your doctor would advise you to check your blood pressure at least every 6 months. Also with venlafaxine, the weaning regimen is more gradual compared to other antidepressants, as it has a higher risk of withdrawal side effects compared to other antidepressants. So I'd usually give venlafaxine if no other antidepressants have worked. Now, Amitriptyline is known as a multifunctional drug because it helps with migraines, it helps with insomnia, it helps with neuropathic pain, helps with abdominal pain due to IBS, as well as symptoms of anxiety and depression. Now, amitriptyline is usually started at a 10 milligram dose for conditions such as sleep and IBS, but for it to work for depression, you want to start at a higher dose of 50 milligrams, which is usually taken once a day, and then is gradually increased in increments of 25 milligrams on alternative days to a maximum of 150 milligrams. Now, amitriptyline is known to have side effects such as dizziness, dry mouth, constipation, blurry vision, and there's also a high risk of overdose of amitriptyline, so it is not one of the main tablets that I would usually give for depression or anxiety. Now, bear in mind that with antidepressants, the higher the dose as you go up, the more the chances of side effects. So most common side effects will tend to be nausea, headaches, dizziness, drowsiness, but the most common side effect, which I mentioned in my earlier video, is reduced sexual libido. So if you're having side effects with increase of medication, you might want to consider maybe going back down the dose. So for example, if you're on 60 milligram fluoxetine and you're having side effects of reduced sexual libido, you might want to go down to 40 milligrams, or you might want to consider gradually weaning off the medication and going on an alternative antidepressant. Now, you can also check out my video on how to wean yourself off antidepressants, and if you found this video useful, please drop some likes, share the video and subscribe.